Welcome to Cruise Control. This is your host Abbas, and I'm here with Dr. Mansoor from Aster Royal Hospital, who is a specialist in orthopedics. And we're here and we're going to be discussing about foot and ankle,
Yes,
right?
correct.
Now, as a layman, I know that there are a lot of nerve endings, all right there. But what's beyond that, doctor? Can you tell me more about what nerve endings or what muscles do we have in our feet and ankles?
Correct. So thank you for inviting me, Abbas.
Pleasure.
The foot and ankle is a very important and complex joint in the body.
Right.
Important in the sense that our whole body weight goes through the foot and ankle. So it helps us walking, running, etc. So all our activities are dependent on the foot and ankle. Complex in the sense that, as you mentioned, there are a lot of nerve endings, obviously. Plus, there are about 30 joints in the foot and ankle.
Wow.
Plus about 100 tendons and muscles as well. So there are a lot of what we call as biomechanics, complex biomechanics going on, especially while we walk and run and things like that. And also, foot and ankle is one of the most common joints injured in sports injuries.
Because your whole weight is on your ankles and on your feet.
Absolutely.
So now recently, Aster Royal Hospital has introduced a foot and
ankle clinic.
Ankle clinic. Okay,
Correct.
so ankles are included there.
Correct.
So tell me more about that.
Yeah, the idea of the foot and ankle came because, as you know, in Oman, there are not many specialized centers for foot and ankle care there. So we have got this amazing state-of-the-art new facility in our Aster Royal Hospital. So where we have got this advanced imaging studies like MRI scan, CT scan, everything there.
Right.
So what the idea of the foot and ankle is that we have dedicated slots for imaging like MRI scan, CT scan, etc. so that the patient doesn't need to wait for reaching an accurate diagnosis of what their foot and ankle problems are. We also have a very good team of surgeons there who is capable of doing all foot and ankle surgeries. We are one of the few hospitals in Oman which does what we call as keyhole or arthroscopic surgery for the foot and ankle, which helps the patient to recover faster from surgery.
Right. And generally, what is the recovery time frame? Like someone with an, say, a normal ankle injury.
Ankle injury.
How long would it take for that person to recover?
Normally, if it's a minor ankle injury, 2 to 3 weeks we are looking at. If it is a major ankle injury, we are looking at about 6 weeks.
Wow.
Usually keyhole procedures as well, the time period about 6 weeks for the injury to recover.
Right. And what sort of problems people come in at your clinic? For example, say someone's got an ankle injury or a foot injury.
Correct.
What kind of injuries do they come in with?
Yeah, we do see a lot of foot and ankle problems. The main foot and ankle problems we see are, one is inflammatory conditions of the foot. Like what we call as heel pain or what we call as plantar fasciitis. Some people call it mismarkadam.
Right.
So where you have pain in the heel, especially while walking in the morning. Then we have got pain in the back of the heel. We call it Achilles tendonitis. Tendon problems.
Makes sense.
And then obviously, as you mentioned, sports injuries, where pivoting sports like football, basketball, where the player lands on the feet and twists their feet, they usually injure the ankle.
And are there cases of like people overworking their foot and their ankle?
Absolutely, like in gym or exercise, they overwork, then also they can injure their foot and ankle.
Right.
Then we also see a lot of what we call as deformities in the foot, like what we call as hallux valgus, where the big toe turns to the lateral side.
Oh yes, okay.
And there is,
I've seen pictures on the internet.
Yeah. So those kind of deformities we see a lot. And then obviously arthritis due to old age can happen in the foot and ankle as well.
So basically when people have these deformities, for example, when do they realize? Is it like an age where they reach and they realize that, oh, something's wrong with my foot?
Yeah.
Or does it happen at a pretty early age? What happens?
Some people develop at an early age. We call it a congenital. When you're a child, you're born with it and it advances with age time. So that is sometimes with like flat feet, those kind of things advance with age. Some people develop it over a time. That is due to bad shoe wear, we call it. Shoes, if you wear tight shoes and things like that, they can develop those kind of things.
So basically when you go out for shoe shopping, take it seriously. I mean, it's not something, you should take it, you shouldn't take it lightly, basically.
Absolutely, that's the most important thing for the foot.
So now people coming into your clinic with problems, of course, they're coming in because they know you have the solution for it.
Correct.
So what kind of treatment are we looking at?
Yeah, these inflammatory conditions that we have talked about, this plantar fasciitis, Achilles tendonitis, what we do is we give a course of anti-inflammatories, we give a course of physiotherapy, but most of them needs little bit of stretching of the foot and ankle,
Okay.
which helps to relax the plantar fascia and everything, which helps these problems.
Right.
We also give an injection called a plasma injection.
I've heard of this actually.
Yeah,
Yes.
PRP or plasma injection that helps with these kind of plantar fasciitis and things like that. The sports injuries usually treated conservatively with what we call as a boot, some rest.
Come again?
Boot, special
A
boot.
Okay, a special boot.
Special
okay.
boot, rest, ice, elevation, okay, and usually they get better with conservative management without any surgery. Very rarely people will feel pain and instability after maybe 3 months, 4 months, then we do a repair or a surgical repair.
So these are the treatments. We've discussed the problems too, overworking, or maybe you have some sort of deformity in your foot.
Correct.
How do you prevent all of this? That's of course the ultimate question. Then how do we not get there?
Absolutely. So the main thing, as I mentioned earlier, is footwear. So right shoes is most important. Especially we have seen nowadays that ladies who wear high heels.
Oh yeah, that looks painful. Just looking at it. It's
High heels and the small ladies shoes with small toe box, we call it. That also is a problem. So what this happens is that you will get contracture of the muscles and tendons if you wear it most of the time.
Right.
And also you will get deformities in the feet as well. Like
And these can develop. Like
This
it's
can
not like it will happen from your child. Like it can develop later on.
develop. You will a normal foot, you use these kind of shoes, they develop over time. So the most important thing is you wear a good shoe. What we suggest is like a trainers with wide toe box, comfortable ones.
Okay.
Men also, it can be a problem. For example, men wear safety shoes.
Yes.
That is like hard shoes as well.
Right,
That
right.
causes problem with the plantar fascia as well. So the best thing for the foot is like soft insole training shoes.
Soft insole, okay, training shoes. And if you have shoes like these, for example, the ones that you're wearing right now, do you recommend getting those soft gel
Absolutely. If you
sole
have
that you get?
if you have any pain or anything like that, that will help for a while. The soft insoles, cushion soles. Yes.
Right. And of course, it needs to be a perfect fit. I guess you choosing the kind of shoes to wear is like getting into a relationship, right? Like it's getting married. You better look around and see that it fits comfortably, because it can cause a lot of problems, all right, guys? So there's a deep lesson to be learned from shoe shopping and from Dr. Mansoor. Thank you, Dr. Mansoor, for coming in and telling us all about foot and ankles. And now I guess people know what to do. As a matter of fact, feet, don't neglect one. I mean, keep both in check. And yeah, if you have any problems, you know where to go. Aster Royal Hospital. Dr. Mansoor, what are your timings? Generally, what days?
Morning I work every day, 9 to 1, and evening 5 to 8.
Okay, and do you have a weekend that you're...
Weekend, Saturday also I work mornings.
All right, being a doctor is pretty tough, and that's why I keep repeating this, that it is a noble profession. I mean, it's you need a different mindset. So thank you for your services, and hopefully, I won't say I'll see you soon, because I don't want any injuries, but you know what to do to prevent injuries. But if you have one, if you want to get rid of it, Aster Royal Hospital is the place to be.
Thank you, Abbas. Thank you.
All
Much
right.
appreciated.